Welcome back. If you are looking for a place to get the updated COVID vaccine booster, we now know Meijer is offering it. It targets two Omicron strains. Scheduling an appointment with a Meijer pharmacist is easy. All you have to do is just text the word COVID to 75049. And Americans ages 12 and up are now able to get their first Omicron updated COVID-19 shots. And as we head into fall and winter, U.S. health officials, they're urging those eligible to get that vaccination along with a flu shot. Mandy Gaither has more on what's expected this flu season and if you get sick, how to tell the difference between the flu and COVID-19.
Is it a cold, the flu, a sinus infection, or COVID-19? Since symptoms of all of these illnesses are similar, it may be hard to tell the difference.
Probably flu will be pretty severe this year. COVID cases will probably go up.
Dr. Barbara Bauer with Ohio State's Wexner Medical Center says anyone who gets sick should pay close attention to all of their symptoms. She says if you have a dry cough, it's likely caused by COVID-19, as cold and sinus infections are tied to nasal congestion, leading to coughs that tend to be more mucousy. A fever might signal the flu. Bauer says a fever can accompany COVID, but not quite as often and rarely with a cold or sinus infection. If you have shortness of breath, it's most likely COVID-19. This symptom only rarely is associated with a cold, flu, or sinus infection. Also, pay attention to how long it took you to feel sick. Bauer says sinus infections and colds typically continue to get worse over a couple of days. Flu affects a person immediately, while the timing of COVID-19 symptoms can vary based on vaccine status and immunity from a prior infection. Taking an at-home COVID test can help.
Just to know whether you were positive or not, and then schedule an appointment with your doctor to see if you're eligible for, certain treatments.
Bauer says the best way to protect yourself from severe illness from COVID and the flu is to get vaccinated. For Health Minute, I'm Mandy Gaither.
And flu cases have been unusually low the past couple of years in the U.S. Health officials say measures to stop the spread of COVID-19, like mask use, hand washing, and staying home, likely contributed to the decline.